reports and case histories are not relevant for trauma orthopedic applications. For referral letters discussing patient handling, you would ideally need a couple of letters, two from yourself to referring to someone else, maybe a tertiary center, explaining about the case details and asking for an opinion, and you can add two further letters from other subspecialties to you, informing you about a patient, for example. Now, where people do get caught out in these is the patient ID. Most of these letters do have their patient names, addresses, hospital numbers, date of birth, etc. You have to ensure that all these details are masked out. Now, the important question comes as to how to mask it out, and there's a little trick here. The best thing to use is black crayon, because if you try to remove print out a letter and then try to put it with either a sketch pen or a black ink pen, you'll notice that when you scan it, the finer details can still be seen and are visible. The only way to sort of obliterate this for sure is to highlight those shaded areas with black crayon and then try and scan it. You'll see that those important identifier details are masked. Patient lists again are not relevant for orthopedic surgery applications. Next, what we focus on is the departmental and the caseload trust statistics. So what you'll see here is every department, especially your managers, will have an idea about the departmental workload, the caseload statistics, etc. For example, I can show you in the hospital, whichever hospital you work in, will have something like a fact sheet, and this fact sheet will tell you about its inpatients, its outpatient numbers, theater numbers, elective, emergencies, admissions, etc. You can get these from each hospital you have worked in. If you have worked in only one or two, it will be pretty straightforward. Your line managers should have these details with you. Rotas, time, job, and job plans, they're very straightforward. As the only thing to make sure is to make sure that your job is, your name is printed on the job rota, because what you don't want is just to give a rota and to not find your name over there. So as long as your name's there, it's on the rota and it's recent, just take a sample of the rota from every hospital you worked in and submit it to them. Job plans will be given elsewhere, so actually I did not bother to duplicate it here. Now, the course is relevant to curriculum. This is quite important, and it's actually a place where some people can actually get caught. So what happens here, the mandatory courses for a surgical specialty are the ATLS, the train the trainers or teach the teachers, compulsory leadership, and a management course for the NHS. Now, my GMC advisor actually wanted some evidence showing that teach the teachers and train the trainers are equivalent and one and the same. So I got a letter from my course provider to this effect. So just check whether you'd want to put that in as well. The ATLS, of course, has to be within the last 3 to 4 years, and it has to be current and valid at the time you submit the application and the time they assess it. So just be sure that you have done within the last 2-3 years, and its 4-year validity should take it through. Regarding the leadership and management course, make sure you do them with a certified provider, and my advice is, when you do these courses, provide a copy of the course syllabus and the course contents as well, because sometimes some of these courses do not have either the title of NHS there, etc., and sometimes this can lead the committee to think that it's about management but not in the NHS. So provide the course contents as well, and that way you're safe. Nowadays, it's mandatory to do a research methodology course as well. I would suggest to do a research course in the UK itself. Clearly, your good clinical practice needs to be current, it needs to be within the last 3 years. So, in addition, if you want to do a research methodology course at your deanery, I think if you book well in advance, it should be free. Otherwise, you can do the online course by the Royal College of Surgeons of England, which costs you about £300. Health Education England also has a research course which can be done. The portfolios, electronic and revalidation, they are filed as part of your application. Employment letters and contracts are pretty straightforward. You will get them when you join. Just get a copy of them and keep them. Job descriptions, they come for every hospital you work with, and for example, whichever hospital you work with will have a job description of your post, whether you're clinical fellow or trust registrar, and just keep a copy of that. That should sort things out. Again, for job plans, you can get them from your manager. This will basically be your current rota or schedule, and in your job plan they basically want to see that you are doing 3 sessions of operating and I think 2 or more sessions of clinics, and that just needs to be in your job plan, so make sure it's there.